So now we are coming to the highlight of the session, and I'm truly honored to welcome Dr. Richard Packard, a distinguished surgeon and educator in ophthalmology globally. Dr. Packard has played a vital role in shaping ophthalmic education worldwide and is one of the key contributors to the new Master's Video Library. Today, he will introduce this cutting-edge educational resource which is transforming how surgeons enhance their skills through video-based learning. May I have the video, please?
My name is Richard Packard. I come from the United Kingdom, and I have been involved in teaching cataract surgery for well over 40 years. My journey in ophthalmic education, particularly in the field of surgery, has been driven by deep passion for empowering surgeons at every stage of their careers. We all start with our journey to becoming a master as tyros, as people who really don't know what they don't know. And in order to become a master, you have to go through various stages of learning. It's important that you do these, so you first of all, after your stage of not knowing what you don't know, you then discover what you don't know, then you learn how to deal with what you don't know, so that you know that you can put it into action. And finally, when you get to the stage of mastery, you are at a stage where you have an unconscious understanding of what you need to know. In order to get to this stage, it's important to realize what the real challenges are in your surgery. There are physical challenges, there are mental challenges, but by and large, if you can break down any difficult procedure into small aliquots of training, of skill, you'll find that by doing this, you should be able, even at a relatively early stage, if you understand what you're doing, to be able to deal with more complex cases. You just need to get your mind in order, and you need to make planning an absolute essential before you deal with that patient. To deal with this as well you possibly can, I think you need to have the ability to be taught well in the operating theatre, but also to have access to high quality materials, videos online and so on and so forth, that are discussed by masters for your benefit. A few years ago, Hoya Surgical Optics got together with ISASO to try and bring forward a platform that would enhance the training of surgical trainees. Until now, Masters has essentially consisted of digital CME courses. There's been some face-to-face, there's been some wet labs, there's been a whole variety of different things to make the path for trainee surgeons better and easier and more successful. Now we're going to introduce something completely new, which is the Master's Video Library. That would enhance the way that the young people could be brought towards mastery in their field. And once they'd achieved that, then they would be able to join the program, of course, and assist in their way. But in the first instance, they needed to get to this stage in their career where they felt so confident that they could take on more difficult cases without worrying about it. It's a very special collection of curated videos which have come from the Video Journal of Cataract, Refractive and Glaucoma Surgery, along with many other high-quality international contributions produced specifically for this library. Global masters that it features are also helped by the quality of the material that will be available to you in terms of the motion and graphic designs, which enhance the whole experience, that make everything more understandable and easier to learn. Within this platform, it is so easy to find relevant videos to your specific learning needs, and over time you can build up your profile and suggestions to further improve your experience and optimize time invested in self-learning through visualization. There's also structured navigation, where you can explore a well-organized library with categories and subcategories designed to streamline your navigation and discovery process, and view the videos which are popular amongst your peers, so that you can understand through this means what is trending and what might be beneficial for your patient community. If what you've seen is something that would excite you, something that you feel would help you towards mastery in your field of ophthalmic surgery, then I would advise you very strongly to sign up and register, because I think you will see some significant benefits going to the future.
So thank you so much, Dr. Richard Packard, for your contributions to this. I would like to understand, for the benefit of the house, how is this resource different from others? Because you do have a lot of content which is present online.
I think this is a very important gathering together of videos. It's unique because it provides a truly video-based education, and the content itself is very credible. It offers you extensive, high-quality videos which are extracted from the Video Journal of Cataract, Refractive and Glaucoma Surgery, which, as you will know, was put together by Dr. Robert Osher, and that's been going for 40 years now. It's a wonderful archive. It also will be including original productions featuring from many leading surgical masters, and each video is carefully categorized and tagged. And that will enable you as surgeons to locate very easily what you want to use to enhance your specific knowledge, and it will make it then into a very powerful tool for you to become a better surgeon, to give your patients better outcomes, which is after all what we really want to achieve.
Who do you think would benefit from it? The learning surgeons, or the experienced surgeons, or the surgeons who want to, refresh their surgical skills?
I think it covers the field. I mean, there are going to be surgeons who've got to a certain stage in their career. Maybe they've done 100 procedures and they feel reasonably confident about doing routine cases. But then they're presented with more difficult cases. As I said in the video, the important thing about this and the training that you can achieve by looking at the videos in the video library is that you can break down a complicated procedure into small and relatively simple steps. And once you've done that, this will lead you forward to enhance your skills. On the other hand, if you're a more experienced surgeon and you maybe want to have a look and see, is there a better way of doing something that you had previously done, and you would like to see if you can do it better, I think that this will provide an expert set of values that you can achieve, and ultimately, as I say, it'll make you a better surgeon and it'll give your patients better outcomes because you've gathered together the pearls that are available in this wonderful collection of videos.